Hello there. Have you or your loved one recently experienced incontinence? If so, you're not alone. It's actually very common among seniors, but it can still be quite embarrassing. In this video, we'll go over some ways to manage incontinence if you or your senior loved one is suffering from this condition. Let's dive in. Incontinence is when a person loses bladder control and may include an inability to control bowel movements as well. It can range from a slight leakage of urine when you cough or sneeze to having frequent accidents that soak through your clothes. The National Institute on Aging estimates that 1 out of every 3 seniors will experience incontinence at some point in their life. But what causes it? Well, there are many different causes, and they can include being overweight, having a stroke, experiencing a spinal cord injury, being constipated, having an overactive bladder or weak pelvic floor muscles, urinary tract infections, and certain prescription medications. Some of these causes are temporary, while others are permanent. So it is important to visit a doctor to get a proper diagnosis, so they can determine the underlying cause and rule out any serious medical conditions. Common conditions that can cause incontinence include diabetes, depression, and Parkinson's disease. Once your loved one has been cleared by a medical professional, here are some ways that you can help them manage their incontinence. 1. Make sure they see a urologist. A urologist is a doctor who specializes in the urinary system. They can assess your loved one's needs and recommend treatment options, such as medications, bladder training exercises, or other therapies. 2. Don't ignore incontinence. While it can be difficult to talk about, it's important to discuss incontinence with your loved one. Ignoring the problem won't make it go away, and it could end up getting worse. A home care provider can also assist with this discussion and help your loved one come up with solutions. 3. Try to find the source of the problem. Incontinence isn't always easy to pinpoint, so if your loved one is suffering from it, try to figure out what's causing it. Is it a medical condition? Is it a medication? Is it something else? Once you know what's causing the incontinence, you can work on treating that problem. This might mean making changes to your loved one's diet or exercise routine, or it could involve working with a physical therapist to strengthen the pelvic floor muscles. 4. Limit fluids before bedtime. One way to reduce nighttime incontinence is to limit the amount of fluids your loved one consumes in the hours before bed. This may mean cutting back on caffeine and alcohol as well, since these can also have a diuretic effect. Waking up at night to use the bathroom is common among seniors, so limiting fluid intake in the evening can help reduce the number of nighttime accidents. 5. Consider absorbent pads or diapers. If your loved one is having frequent incontinence accidents, consider using absorbent pads or diapers. These products can help contain the mess and make cleanup easier. There are a variety of products available, so talk to your loved one's doctor or a medical supply company to find the right ones for your loved one's needs. Absorbent pads or diapers may be reusable or disposable, depending on your budget and preference. You can purchase these online or at most medical supply stores. 6. Use safety measures to prevent falls. Falls are a leading cause of injury among older adults, and incontinence can make falls more likely. That's because the rush to get to the toilet can sometimes cause people to fall, especially if they're trying to get there in the middle of the night. To reduce the risk of falls, make sure you're loved. One's path to the bathroom is clear and well lit. You may also want to install grab bars in the bathroom or near the bed, and if necessary, consider using better chair alarms to alert caregivers when your loved one needs to use the bathroom. Bedside commodes are another option, which are helpful for those who have difficulty getting to the toilet. These are small chairs with a seat that can be removed and placed over a toilet. They're useful for those who can't walk or have trouble balancing themselves. 7. Consider an external catheter. An external catheter is a tube that drains urine from the body. It's inserted into the urethra and can be attached to a bag or bottle to collect urine. External catheters may be a good option for men who have difficulty urinating due to enlarged prostate, or for women who have difficulty holding their pee. However, it's important to note that external catheters do require regular cleaning and maintenance to prevent infection. 8. Undergo bladder training. Bladder training is a series of exercises that can help improve bladder control. It involves holding your loved one's pee for longer periods of time and then gradually increasing the amount of time. This can help stretch the bladder muscles and make it more difficult for urine to leak out. In addition to bladder training, pelvic floor exercises may also be helpful. These exercises involve tightening the muscles that support the bladder and other internal organs. They can help strengthen the pelvic floor and reduce the likelihood of incontinence. 9. Keep track of fluid intake. If your loved one is having trouble with incontinence, it may be helpful to keep track of fluid intake throughout the day. This can help identify any patterns or triggers for accidents. For example, drinking caffeinated beverages or eating high-salt foods may contribute to increased urine production, which can lead to accidents. Keeping track of fluid intake can help your loved one and their doctor determine how much fluids are safe to drink each day. 10. Eat a healthy diet. Eating a balanced diet full of nutrients can help improve overall health and reduce the risk of incontinence. Specifically, getting enough protein. Vitamin D and fiber can help keep the body functioning properly and prevent muscle loss, which can contribute to incontinence. In addition, staying hydrated is important since dehydration can make urine more concentrated and increase the risk of bladder infections, which can worsen incontinence symptoms. 11. Consult with a social worker. Incontinence can take a toll on a person's mental health, so don't hesitate to reach out to a social worker for help. Social workers can provide emotional support and help seniors and their families cope with the challenges of incontinence. They can also help connect people with resources in their community, such as support groups or respite care services. 12. Hire a caregiver. Hiring a caregiver can provide invaluable assistance to both the senior with incontinence and their family members. A caregiver can help with toileting, incontinence, product changes, and other personal care tasks, allowing the individual with incontinence to maintain their dignity and independence. In addition, caregivers can provide companionship and emotional support, which can greatly benefit the mental health and overall well-being of a senior dealing with incontinence. Caregivers can also educate themselves on best practices for incontinence care, ensuring that the senior receives the best possible attention and assistance. Incontinence is a common issue for seniors, but it doesn't have to be debilitating. The right resources and support, seniors can continue to live full and active lives. Remember, seniors with incontinence need extra care and understanding, but they don't need to be ashamed or embarrassed. There are plenty of resources available to help them cope with this condition, so don't hesitate to reach out for help.
We hope this video was helpful.
Please share it with anyone who might benefit from this information. We wish you and your loved ones all the best. Until next time,